Good morning. Thank you for being here this evening. This is a very quickly called news conference this morning for us to discuss COVID-19 with folks of the Wayne County area. We have several folks with us here this morning. I'm Commissioner Ken Powell. I have to my left here Mayor Dave Snow from the city of Richmond. What I'd like to do first is to have everybody introduce themselves that are with us here this morning, and we'll start to your left, my right, with Mr. Kenyon from Reed Hospital, and we'll go up to Christine and over and then back to me.
Thanks, Ken. Good morning. Glad you're all here. My name is Craig Kenyon. I'm the president and CEO of Reed Health.
Good morning. I'm Christine Stinson. I'm the Executive Director of the Wayne County Health Department.
Good morning. I'm Dr. David Jetmore. I'm the Wayne County Health Officer.
Good morning. I'm Dr. Tom Huth. I'm the VP for Medical Affairs for Reed Health.
Good morning. I'm Misty Faust-Cofield, Vice President and Chief Nursing Officer at Reed Health.
Good morning. My name is Dan Burke. I'm the Preparedness Coordinator for Wayne County Health Department.
Good morning, Mayor Dave Snow.
First, what I'd like to do this morning is to call on our Public Health Officer, Dr. Jetmore, for his comments, and then he'll move on to Dr. Huth from Reed Hospital, and then we'll have some general discussion from all the folks that are here with us this morning. So, Dr. Jetmore?
Yes, thank you, Ken. We're having this press conference because we've had the first presumptive COVID-19 case here in Wayne County. This is a person from Franklin County, and when these cases are reported as occurring in the state, they're done by the county of residence. So this case will be assigned to Franklin County, which is where that patient lives. We will be working closely with the Health Department of Franklin County regarding this case and helping to ferret out any contacts that we can find that this person's had with other people who may or may not be sick or may not need to be tested. I'll let Dr. Huth comment further regarding this patient.
Thank you, Dr. Jetmore. As you know, the virus in question began in Wuhan, China, back in December, and we've all been watching it make its way around the world. And consequently, Reed Health, like every other health system in the state, has been actively preparing for this moment for weeks. And so from our perspective, it's been a matter of not whether we'll have a case, but when. And I'm proud to say that Reed Health is very prepared, and as we go along here, we may be able to speak a little bit about our own preparation actions to protect our healthcare givers who we rely on to help us when we're ill, and also to help protect the most vulnerable in our community. And this particular individual in the hospital now presented recently to the emergency department for evaluation of a variety of symptoms, but he rapidly became identified as a person under investigation, we would call it, and appropriate actions were taken to safeguard staff and to care for this individual in the appropriate setting. And then we received the notification of the positivity of the first level test last evening. But that doesn't really change what we're doing to care for the patient. We've been taking the right precautions all along. And let me stop there and see if my colleague Misty Faust-Cofield has any comments on the steps that we take internally to care for our patients.
Absolutely. So we have protocols in place currently that are restricting visitation to protect not only the healthcare providers that we have at Reed who are armed and ready to take care of this patient population, but also to protect the spread and to flatten the curve of the exposure. So we have multiple things in place that include, most of you may have heard, we are canceling elective surgery cases beginning Thursday. Patients who need surgery will have surgery, but those that are more essential and really, I would say, non-urgent in nature will be postponed till a later date. We are also doing the same thing with office visits at a variety of our locations. So visits that are wellness in nature, visits that are not urgent, will be postponed till a later time to protect and flatten the spread of this issue.
Okay, at this time, then, what I would like to do is if there's any questions you'd like to ask of Dr. Jetmore or Dr. Huth, we would do that, then come back. I'd like additional comments from Mr. Kenyon, and then when we're all finished, Mayor Snow and myself will wrap everything up with what we're planning to do additionally here in Wayne County. So if I do have any questions at this time, we'd be happy to entertain those.
Dr. Jetmore, can you talk a little bit about the importance that people abide by the kind of the guidance that's been put out there by the CDC and State Department of Health in terms of social distancing and staying 6 feet apart from people and staying home unless you have to go out and things like that? How important that really is that people take that seriously?
Yeah.
Dr. Jetmore, if you could maybe repeat the question so the TV audience can understand.
Yes, Mr. Truitt asked about a lot of the things we're asking our citizenry to do in terms of avoiding large groups, social distancing, trying to stay 6 feet away from people. I'm glad you asked that question because it's so much easier to do something if you understand the reason why. Why shouldn't I touch my face? What's this deal about washing my hands? Well, this virus is an incredibly infective virus. Its infectivity rate has been reported to be 3 to 8. Now, let me explain what that means. If you have somebody with the ordinary flu, they'll infect 1.2 other people. If the infectivity rate for coronavirus, this particular coronavirus, COVID-19, is 3 to 8, meaning they'll infect 3 or 8 other people. Now, how does that happen? Well, most of these people, or 65 to 80% of these people, are coughing or sneezing. And when they cough, droplets fly through the air. These droplets will travel 5 or 6 feet. That's the reason for social distancing. When these viruses hit your face, when you breathe them into your lungs, or they hit your eyes or the mucous membrane of your lips, you become infected. The other way we catch this disease is when we touch surfaces when we're infected. We shed these virus particles on doorknobs, banisters, countertops. And when we touch these surfaces and carry them to our face, we infect ourselves from these surfaces. So this is the reason for the hand washing. And there's no need to go out and buy 18 bottles of hand sanitizer. Washing your hands with soap and water for 20 seconds is going to kill all of these viruses. So thanks for asking that question.
If I could maybe add a little additional information to that great description by Dr. Jetmore. The virus is it's a curious one to me. It's, as I think everybody knows, this is in the family of coronaviruses, so there really isn't just one coronavirus. This particular one is in a large family of viruses that very commonly cause colds. And for many patients who acquire the illness, that's what they have as a cold. And actually, for the vast majority of people who become ill with it, they're not particularly ill, and they can be managed at home. They get better all on their own with general conservative care. But unlike the common cold virus, there are some people in our community who are particularly vulnerable to complications. And these are the people who may become severely ill and need to be hospitalized or have life-saving interventions such as mechanical ventilation and so forth applied to them to help them. And it's those people that we want to protect. Mm-hmm. It's not necessarily the general run-of-the-mill, the general people in the community who may get a cold and recover, and that's it. But those people are going to put their family and friends who are in the vulnerable categories at risk. And so we think about the way viruses spread through the community, through transmission one person to another. The measures that are being taken, to me, are very commonsensical, not just social distancing, but reducing the interactions we have in public. Those, in my mind, what they do is they set up a fire break. It may not it probably won't totally reduce the spread of the virus, but it will slow it down to help give our systems more time to help identify the people at the highest risk and help them earliest, and to keep the resource use below the capacity of the health system. Now, fortunately, at Reed, we have plenty of capacity, but that's not an excuse to not take the steps that we all should be doing. We all, as the people who are at less risk, sort of have a responsibility to those who are at higher risk. That's why we should exercise good hand hygiene, social distancing, stay home when we're ill, and avoid contact with people who are at higher risk, even if we're feeling well. Because that's one thing about this virus, is that at least in the earliest stages, we may be shedding virus, but we don't really know that we have it, and so we're still a risk to other people. And so that's why we want to take it seriously.
Can I add something to that, and why we're doing these kind of unprecedented restrictions? Like everyone has said, most people will have very mild symptoms when they contract COVID-19. And it's we're not able to do surveillance testing at this time. So it's important for the public to understand that you may have the virus and you may be shedding the virus and not know it. A lot of the younger people, the studies that I've seen, are more asymptomatic and but have a higher viral load, and so they're easily shedding this. And until we're able to do some more mass testing, where we're actually doing surveillance testing, we won't know truly where there are necessarily hot spots or rapid rates of transmission in our community. So until we have surveillance testing, we need to treat everyone as if you have the ability to shed the virus.
Sir, you have a question?
Yeah, now I know so far with this virus, other than the illness, one of the biggest obstacles has been actually obtaining one of these tests. Now I know there are 1.9 million tests just distributed through the United States. How many of those are going to be accessible right here in Wayne County? Like, if you're starting to feel the symptoms, how hard is it for someone here to get one of these tests? How far along do they have to be before someone says, okay, we can get you a test? Walk me through that procedure of, if I'm feeling the symptoms, how I get a test.
I'll start. That's really kind of more in your area, if you want to take it, Christine.
Well, and that's what I'm talking about with surveillance testing and our limited ability to test. So from what I'm understanding, we're still following the ISDH algorithm for testing, which means if you're symptomatic and you feel like you have it, you need to self-isolate at home. If you get to the point where you think you need palliative care, call the hospital first, and they will give you directions as to what to do. If you are feeling sick, you need to call your doctor. Don't show up to your doctor's office. Now that we have private testing going on with 2 private laboratories, testing is going to increase. But with the increased testing, we're going to see more cases. Wayne County, although we've had 1 person test positive in Wayne County, isn't a resident, that doesn't mean that we do not have COVID-19 in our community. We assume we have COVID-19 in our community. We're just waiting for that confirmation test result to come back on one of our residents. So I would turn to Dr. Huth and explain how Reed Hospital determines who gets tested.
Well, we at Reed, we're following the recommended guidelines by the Centers for Disease Control and the Indiana State Department of Health, by asking the questions, screening questions to identify those at higher risk. And under some conditions, the State Department of Health will authorize testing, and we're following those guidelines. The state's restrictions on testing capability really had to do more with partly to do with their own supply of ability to process tests. So it's not just having the local kits locally, which are limited, but there's also their ability to process the tests at their lab. That's a limitation right now, but I think that it's obvious that the state and federal authorities intend to make testing much more widely available, and I have a feeling that in the reasonably near future, it'll be much more accessible. I can't tell you when or how accessible or how it will be done, but I know that that's their intent, and we're waiting with everybody else to kind of find out what that is.
Yeah.
But I would say this about testing. I think it's important that we don't give people false hope about what the testing will do for us. For the average person walking in the street who feels well and just wants to know if they've been exposed, if you go have a test in that circumstance and it's negative, what does that mean? Answer is we don't really know. Do we know, can we say categorically that you haven't been exposed and that you won't become ill with COVID-19? Not really, because we don't know, nobody knows very much about how long it takes after exposure for the test to be positive. The only thing we know for sure is that by the time you're having symptoms, it should be. Consequently, we don't want people to think that they can just go get tested and be reassured that they're never going to become ill or that they are ill. It's much more nuanced than that. Now, that's a different situation from doing lots of testing on a sort of an epidemiologic basis to try to understand the extent of exposure in the community. And that is certainly going to be worthwhile scientifically to understand that. And we know that several countries around the world actually have better experience in terms of outcomes with their coronavirus cases, partly because they have been able to much more rapidly expand their testing capability to the general public. And I'm thinking specifically of South Korea and Taiwan. Granted, they're smaller countries than the U.S., much more geographically limited, but they have a policy of making tests very widely available on a drive-up basis, and that helps the public health authorities figure out who are potential contacts, and it also helps to understand the statistics better, so that when we look at things like case fatality rates, they can seem high until you do much more wide-based testing, and then you have a much larger denominator of known cases. And then, therefore, the case fatality rate is much lower. That's the case with things like influenza. It's much more widely tested, and so that the case fatality rates for influenza are in the order of 0.15%. But in the U.S. currently, we're probably running in the 3% range. So far, it's very early days to know for sure. In China, it's been consistently about 3.4%, 3.7%. But in South Korea and Taiwan, it's about 1%. So that's higher than flu, but much less than people's fears have been. So I hope that gives you a little bit more background on testing. We're not banking all the things that we're doing on testing. It'd be nice if it were more available, but I'm personally not worried about not being able to be tested, because I understand the nuances, and I don't think it's wise for the average person on the street to think that testing is somehow going to be some kind of panacea for them.
I had a follow-up with that, too. Did we open ourselves up to disaster by inviting someone from Franklin County into Wayne County where we've had 0 confirmed cases? Is there a reason they didn't go to like Marion County where there's already confirmed cases? Is there a reason they were brought to Wayne County specifically?
Well, I can't speak to the specifics of this case. I don't really know all the details of how the individual came to our attention, but what I can tell you is that Reed Health is the main health system for this whole part of the state. We commonly have patients referred to us from the surrounding counties. And, there really is not a particularly high risk of this particular individual starting an outbreak in Wayne County, because we have him under control and controlled conditions. The truth is that what it means is that there probably is more virus in the community already. It's not this particular individual's fault. It's not our fault for having him here. We're like every other hospital and we are seeing lots of people who have respiratory illness because that's what's the most common thing this time of year. And all those individuals have to be evaluated for their risk for COVID and appropriately tested if they screen in by the screening criteria. And we're no different than any other hospital. So I don't think it's helpful particularly to worry about somebody from Franklin County come here. We have people go to Franklin County all the time. People from Franklin County come here all the time. And that's true for every county surrounding us. And, my own view is COVID is in the community in all these areas.
Jason.
So, just so we're clear, there was an announcement from Reed that a patient from Franklin County had presented at a Brookville doctor's office down in Brookville and had a presumptive positive test. Is this the same individual that we're talking about, or is this a different individual?
I think we can probably safely confirm for you that it is not the same individual.
Okay. Another question. So yesterday, the city and the county put in a number of restrictions in place. Are either of you, both of you, considering more restrictions at this point in time?
I'll let Dave start first. We are.
Yes, we are. So we did put some restrictions in place, and this is a good time to reiterate some of those restrictions. And one of the things that we just can't stress enough is that following the given guidelines and taking preventive measures are far more effective than panic. And so we continue to ask people to follow these preventive measures of hand washing and cleaning of high-touch surfaces, staying away from groups of 10 or more. And these are all just CDC guidelines that we're all being asked to follow. As we look at some of the restrictions that have been put in place on the city side, and then I'll ask Commissioner Powell to speak about on the county side, we have been working together as a team to restrict some public access to our government buildings for the safety of our citizens and for our government employees. We have closed some of our city offices. Our parks office is closed, our sanitation office is closed, as is our senior center. That has also brought a cease to our winter farmers market, which will start back up in the summer. By executive order yesterday, we have suspended late fees and disconnects in our sanitation department to assist with this. And then we're asking all citizens to first exhaust all other options before coming to City Hall, trying a phone call, using the website, using email. If you must come to City Hall, then we're asking everyone to enter through the lower lobby, through the police department lobby. There is a brief health screening there, as is at the county building. And we're using 99.6, I believe, as the temperature threshold before people come into the building. So those are some of the restrictions that we put in place to reduce the spread of illness. We are increasing our cleaning services, so that we are making sure that where the public enters, we're doing more cleaning to continue to make sure everybody is safe. What Commissioner Powell and I have been working on is taking one more step in our precautionary measures and working on a level 2 travel advisory that would reduce travel to essential travel only throughout the county.
I can certainly say the mayor and I are in constant communications with each other, and I certainly appreciate this. The mayor and his staff has been very, very helpful to us. Yesterday, the Richmond EMT service helped us in testing all of our folks, not only in the annex but in the county. And Dave, we certainly appreciate that very much. Without your help, I can tell you that was very, very successful. We did identify 2 individuals yesterday, one an employee of Wayne County and one a citizen that did have high temperatures, and we did send those folks home. So they could not possibly come in. They may have just had a bad cold, but the testing definitely has worked for us. And as Dave has said, we have restricted to essential business only within the Wayne County Annex, as well as the courthouse. As far as the fairgrounds, those folks that may have had rentals in those areas, if they've rented the property, we're leaving it up to them. But as they're recommending, if you're going to have more than 10 people, we would suggest that you cancel your event. As Dave talked to you folks, we had a long discussion last night about whether or not to call a level 1 or level 2 emergency declaration. And in all of our discussion with the other commissioners, we will be declaring here this morning at 09:30 an emergency declaration of COVID-19, and we will put a level 2 in place. Level 2 means essential travel only. That means we're encouraging you to stay at home. If you do need to go to the grocery, need to go to the doctor or something like that, you can certainly do that. We will not stop you from doing that. If it really got more serious, we would move to a level 3. At that point, only on an emergency situation would you be allowed out into the city. Dave and I work very closely, and as Dr. Jetmore has told me on numerous occasions, Ken, every 15 minutes this changes. So what we tell you here this morning, later this morning or this afternoon, this could change. But we want to let you know that we're working together in the Wayne County area to keep you folks as safe as possible. I know this is different. It's an unusual time. We're asking folks to do things that you never thought 2 weeks ago to be doing. I know in the county we have volunteers assisting us that have come forward and said, Ken, what do you need? And I said, I need people to take temperatures and work with us. And our departments have come forward and are doing that, and I really thank those folks for stepping forward. So if you do have any questions on either the city or the county, again, I can't emphasize, if it's not essential, do not come to the city buildings, do not come to the county building. The one person yesterday that we had, when our deputies saw him coming in, this gentleman was real red-faced and he was sweating. He had 101 temperature when he was coming into our building. He said, yeah, I'm really feeling pretty bad. Folks, have common sense. If you're not feeling good, stay at home. And that our goal is to keep government open and functioning this time. So you can call into the city building, email the city building, same with all of our county offices. What your question is, we will get back to you by phone or email with those questions. Do not come in to our facility. And I know Reed Hospital is testing, or not testing, but questioning folks as to whether or not you can enter into the facility there. So I would like to move over to the president of Reed Hospital, Mr. Kenyon, for any comments that you might have.
Sure. Thank you, Ken. I'll just echo a few things that were said earlier. As Dr. Huth pointed out, this virus was really detected first in December of 2019 in China. You can imagine this being brand new, no history, that the beginnings of making the tests that would be sensitive enough to detect the tests, of course, immediate work on vaccines, which are still a long ways off. We're used to our seasonal flu vaccine every year coming around like clockwork. This one's brand new. This is what a brand new vaccine process will look like, and we'll see when that unfolds. But this is an international effort. In other words, the whole world is focused on this. So all of the testing companies across the world, the scientists, and the World Health Organization, the CDC, are all focused on doing this. So we're all waiting for those results and those different things to come forward, whether those are breakthroughs in testing and mass distribution of testing, which we're hearing more about coming, or we hear about vaccines in the works. So we're hearing some good news. We just don't have any timetables on some of those. I think giving people empowerment, what Dr. Jetmore said, giving people things they can do is probably the most actionable thing from this session here that we can communicate. And it's as basic as what my mother told me from years ago: wash your hands, wash your hands, wash your hands. The indications of soap with the virus is the virus gets destroyed with soap far more effectively than hand sanitizer. There should be a run on soap bars rather than hand sanitizer actually in the supermarkets. So wash your hands with soap. It is your #1 most effective tool. As Dr. Jetmore said, touching your face and touching other parts of your face can also help spread the virus from your hand that you've touched something onto your face. So basic prevention. Cover your cough. A lot of people have been doing this even before we had COVID, and that's always timeless to cover your cough, reduce the spread. It's not perfect, but it helps slow things down. And also what's been mentioned is clean surfaces frequently. The virus, as it's floating in the air, eventually comes down and lands on flat surfaces. Cleaning flat surfaces, even though they look clean, is always timeless with an antibacterial cleaner. So these are some of the lessons we've learned also, and the benefit of being in the United States is we're benefiting from those that have gone through this before us, South Korea and Italy. So South Korea had a totally different result than Italy. Italy had a much more widespread, what we call a surge. That's where a lot of people got acutely ill and critically ill at the same time, which has overwhelmed the health resources of Italy. South Korea took more of a different approach in doing the things with washing your hands, cover your cough, clean surfaces, and had a fraction of the issues that Italy had. So flattening the curve is the buzzword being used, and that's talking about the trajectory of the infections. So if we can flatten that curve out, there's going to be a certain number of the people that are infected that are going to get into acuity issues that go up. We just don't want them all at once. And the best we can do is by reducing activities in our community, which has already happened. It's happened here in this state, and we're seeing it across the country. So the ability to slow down the interactions of people, restaurants, bars, movie theaters, gatherings, and so forth has all been to that very issue of flattening the curve. So flattening the curve is something we're all focused on, and that's why we have the restrictions were just also announced here within mobility of Wayne County. So flattening the curve helps us prevent the surge. We're all worried about surge in healthcare, getting overwhelmed by mass numbers of people coming in with acute infections all at the same time. So to the extent that we can prevent the surge, this is where all the activity is focused on reducing interactions and social distancing. We also are limiting elective procedures at Reed. This has come as a directive also to keep those resources available in the case we do have a surge. So we want to keep our resources available for that eventuality, but also to reduce exposures from elective procedures that can be deferred down in time. So people that still need to have urgent procedures will have their procedures. We're just flattening out some of the interactions of elective procedures through hospitals across the country. So Reed is participating in that. So in summary, the CDC guidelines, local, state, and federal directives are all what we're absorbing and following because we have to follow the lead of the people that have the information and the best minds we have working on this. More locally at Reed, my job is to protect our staff. That's my number one job. If I can't protect our staff, I can't protect our patients. So I have to protect our staff. So the ability to screen people from getting into the organization without being identified as potentially harmful can help us in that effort. So if people are wondering all the measures at Reed that we've taken to slow down or put friction on incoming people, well-intended to visit, it's because we're trying to slow down the interactions to keep our staff healthy. If we lose our nurses and our physicians, we will be in bad shape for handling the surge. So I would continue to hit that mantra, but also provide the reasons so people understand that we would prefer not to have restrictions and have people see their loved ones and support them. However, the offset is the exposures, which can be far more detrimental.
Yeah. Now, speaking of surge, one of the big hot buttons in the news so far, it's either respirators, ventilators. I'm not a doctor. I'm not sure which is which. I know we're contracted to be making some more of those. Does Reed have any dibs on those? Do we know how many we have at Reed? Like, what would a surge be? What's that round number to where we start saying we're running out of stuff? We're running out of ventilators. We don't have enough for everything. Is there a round number to where we know?
Misty, you may want to handle that one.
Sure, I can take that as managing operations. So we absolutely have adequate supply of ventilators for what we know right now, given that in a week that number could change. But we are well equipped to handle that. And that, to Craig's point, that is one reason that we will be closing elective surgeries, not only to have the resources in staff available to equip a surge, but from an equipment perspective, we will have space and equipment available that would usually service those areas, but would be available for surge if and when needed.
And then there are also, you might be referring to the personal protective equipment for caregivers, the face masks and such. Certain of them are sometimes referred to as respirators. We refer to them often as N95 masks, and then there are other types of healthcare worker protective equipment that we can use that are higher level than that. We have adequate supplies of those, even though nationally they're in short supply and difficult to get. We have a well-managed materials management system so that we have plenty for our needs, although because they are in short supply on the market, we are taking commonsensical steps internally to try to conserve that supply to make sure we continue to have that. I think the important thing to know about masking is, for the general public's purposes, there probably is not a good reason for the general public to wear a mask. There's not good evidence that if you're well, wearing a mask by itself will prevent you becoming ill, because unless you're too close to somebody and right in the sort of the radius of their aerosolized virus particles. Other than that, the way we normally acquire a viral disease is actually through contact, hand contact. That's why hand washing, in particular, for this specific virus is actually more effective than the hand sanitizers because of the characteristics of the virus, and Mr. Kenyon mentioned that. But so the mask wearing is probably, on the other hand, if you have a cold or flu-like syndrome and you have to go out or be around other people, then you are protecting them by wearing the mask. That reduces the spread, the radius of spread in a cough or sneeze. Now, our caregivers wear their own personal protective equipment when they have to work in close proximity to patients with respiratory illness. And we have standard procedures and protocols for that, all following the ISDH and CDC guidelines. So I know that one of the things that have disappeared from the retail sites, supermarkets and such like, are face masks from the pharmacy departments. That was really kind of unnecessary. They're not going to help the people that have hoarded those and think that they need them. I wanted to make one other last comment to make sure we got it in about what we think that people should do if they have a respiratory illness. First of all, if you get the common cold symptoms, which most people with COVID are going to have, the first thing you should do is just simply stay home. There's no reason to go to the doctor just because you have a cold and we're worried about COVID. Most people, there is not, like the common cold, there is not a specific antiviral treatment. People get over it in a reasonable period of time, but they need to socially isolate themselves, basically, and try to avoid infecting other people, whether they have a common cold or the influenza or COVID. The treatment, the first initial self-care steps are exactly the same, and that's going to be for the majority of cases. The only reason to go to the doctor to be evaluated is if you develop more worrisome symptoms like shortness of breath, very high fever that doesn't improve with Tylenol and such, or other symptoms, dehydration, things that make someone think that they could potentially be more ill than the typical common cold. But in that case, you should not simply get in the car and go to the urgent care or go to the doctor's office. We should always call ahead and say, I'm having these symptoms, what do you want me to do? Our staff are prepared to do an over-the-phone screening process and give advice about whether to come in, and if so, how we're going to arrange their visit to avoid them contaminating the environment, contaminating our providers, contaminating other patients being seen.
Ma'am?
Yeah, I actually have a two-part question. One, would random testing help us to basically be more aware of what the percentage was in our community? I mean, is that something that's feasible?
It's not feasible at this time simply because of the availability of testing.
We don't have the tests. They did this in Korea. I think they tested 250,000 people. And, their mantra was test early, test everybody. But we're in a situation currently where we simply don't have the tests to do that.
Okay.
But it is feasible.
Okay, all right. And the second part of that question is that you said we're at a level 3, or a level 2 travel, which is essential travel only. And I have a lot of people listening right now, so I'd like you to clarify when you say essential travel.
Well, what the mayor and I are talking about on the level 2 is essential travel only. We're encouraging folks to stay at home unless you need to go to the grocery store, you need to go to the doctor, or you have some other appointment, your children may have a specific appointment. We're not saying you cannot leave your home, that you cannot do your normal day-to-day business, but we are saying this is serious. It is a level 2. We have 3 levels, levels 1, 2, and 3. We have discussed the level 3, but we're not at the point where we think we should do that. If we went to a level 3, the only reason you could go out would be an emergency if you had to go to the hospital. Otherwise, our enforcement folks would ticket you and so on in that case. So basically, with the level 2, it's essential travel. You should have plenty of groceries and stuff at home. If you look at the shelves, it's obvious. If you watch the news, you watch for distribution, and you listen, there's plenty of food in the distribution system. They have basically, last night I was watching a program, they have basically 2 months of food within the system, but when everybody goes out and cleans the shelf today, you have to allow that distribution system adequate time to restock those shelves on there. So what we're saying is essential, the same as we're saying in the city buildings, as well as our county buildings, essential only. Call in, email us. If it's not necessary, don't come in, because we will be able to answer those questions for you. Any other questions? If not, any final comments from any of our folks? Christine?
I think everything has been addressed, and I appreciate the public heeding the recommendations and the guidelines from ISDH and the Wayne County Health Department.
Okay. Dr. Jetbauer?
Yeah, I just want to echo the fact that when you follow these precautions, you're not only protecting yourself, but also protecting all your fellow citizens. So these are a hardship in the short term, but in the long term, they'll pay great benefits.
Dr. Booth, excuse me.
I will just say that we're extremely proud of our team at Reed, and very proud really of our health department colleagues in the serious way that they've engaged with us in managing this situation, and us helping them as much as we can. We're very proud of our teammates at Reed for being the solid professionals they are, very skilled and caring caregivers, and they're managing all this very, very well. And we're also proud of our community. Reed we have visitor restrictions at the hospital, and virtually to a person, it's been well received. People have been thankful and very understanding. So we're very appreciative of that.
Thank you. Ma'am?
Yes, so I would just like to echo what everyone has shared, and just to remind everyone, the best thing that we can do right now is to self-quarantine and follow all the guidelines that have been issued. If you feel the need that you are in a health situation where you're having difficulty breathing, like Dr. Huth said, if you are highly febrile with a raging fever, fatigue, if you do make the decision to present to a doctor's office or the emergency room, please call ahead so that we can send out healthcare providers and the appropriate equipment, so we do not increase the spread of this.
And our coordinator, Dan?
The only thing I would have to add is for the food establishments in Wayne County, it's pickup and carry out only. We don't want customers going inside the establishments. We want the employees greeting the customers at the door, taking the orders at the door, and not forming lines inside establishments.
Mayor?
Thank you, Ken. I just want to thank the leaders in this room, thank the media, and thank the community for taking this very seriously. We know that the restrictions in place are certainly an inconvenience, but these restrictions are for the safety of the public and for the employees of this city. So we will continue keeping government working for you. We want to continue to be accessible to you, and of course we want to get through this so that these restrictions can be lifted as soon as possible.
And concurring with that, we thank all of you for coming this morning. Thank our listening audience here. If you do have a question, make that telephone call, listen to the news. We'll stay in touch with all of you. And remember, at 09:30 this morning, the level 2 will go into effect, essential travel only at this time. We thank you all. And Mr. Kenyon, you have one final comment.
One final, a plug for Read Health Now app. It's an app that we've had around for quite some time, but we added a new feature to it. It's a COVID screening feature, which is free, F-R-E-E, no charge. Go online and you can see it in the privacy of your telephone. Talk with a nurse to go through screening for people who are apprehensive about issues. It's a great tool. The last thing we want is for people to be at home in distress and thinking they should stay at home when they really should be in the hospital. And that's part of the screening process, is to give people peace of mind that they have maybe minor symptoms and there's nothing to do, or they in fact are escalating into an area in which they need to be seen by a healthcare professional. So that app has a special feature on it for coronavirus screening, which is free.
Any final comment from those folks that are with us here this morning? Yes, sir.
Just one final question. This is for Dave. Dave, I love the city. I know you love the city. Where do you see Richmond 1 month from now? And I know we're all playing this day by day.
We are certainly playing this day by day right now, and so we just have to wait and see how this changes. I don't think we are at the peak of this yet, and so once we believe we are on the other side of the peak here, as Mr. Kenyon has continued to point out, flattening the curve for our healthcare professionals, then we'll see some of these restrictions lift. So hopefully as we move into our spring and summer months, we will see an abatement of some of these restrictions. That, of course, is the hope. And if we all follow the guidelines that are laid out and we take this seriously, we can certainly bring ourselves to the other side of this faster.
Any other comments or questions? Yes, yes.
And I would just thank everyone on behalf of the residents of Wayne County for all the work that all of you are doing for all of us. It's greatly appreciated.
Thank you. Anything else? If not, we thank you all for coming, and if we all, as Dave said, it's a matter of all of us working together, and if we do that, there isn't any doubt in my mind Wayne County will get through this without any problems at all. Thank you very much for coming.